Hey everyone, Dr. Fraser here. Today I'm excited to share a powerful at-home tool that's transforming how we monitor heart and artery health for better longevity. This is the CONNEQT Pulse from CONNEQT Health. You can see it here. It's just a pretty standard sized device, has a little cup and has a nice little display. The FDA cleared device goes far beyond basic arm blood pressure, or otherwise known as brachial blood pressure. It uses proven SphygmoCor technology, the gold standard in pulse wave analysis, to give us deeper insights into your central arteries and heart function. A quick arm cuff measurement, which takes less than a minute, captures your pulse waveform, and the app delivers advanced metrics right to your phone. Here are the most common questions I get about it, along with some clear answers.
Why isn't regular arm blood pressure enough, and what makes the CONNEQT Pulse different?
So standard arm blood pressure, which is called brachial blood pressure, gives a peripheral pulse but doesn't reflect the true pressure in your central arteries like the aorta that directly stress your heart, brain, and kidneys. So measuring what your fingers and your arm is getting in blood pressure is indicative, but it actually misses a lot. The CONNEQT Pulse is clinical grade, FDA cleared, and uses validated technology backed by decades of research. It analyzes your pulse wave to provide advanced parameters that reveal hidden risks much earlier, helping us catch vascular aging and optimize longevity proactively.
What key things does it actually measure?
It gives several important metrics beyond basic blood pressure. And this is a warning, this is a quite technical part of the presentation, but it is something where we can help you interpret these. But just to give you an idea of what this device does, we'll go through each of them. So it does a central blood pressure, both a systolic and diastolic. This is the real pressure in your aorta between heartbeats and during the heartbeats. Why it matters. It's a better predictor of organ damage to the heart, brain, and kidneys because that's the actual blood pressure that they're seeing. Central systolic blood pressure over 130 millimeters of mercury can mean up to 3 times higher risk of heart attack, stroke, or heart failure. The next thing that it does is a central pulse pressure. This is the difference between central systolic and diastolic pressure. And why it matters. Higher levels, such as over 50 millimeters of mercury, signal stiff arteries and extra work for your heart, and is linked to a 2 to 3-fold greater risk of major events. The next thing is something called pulse pressure amplification. How much pressure changes from your aorta to your arm. And why it matters is lower amplification, under 130%, shows early artery problems and can mean 2 to 3-fold higher risk, even though your brachial blood pressure could look totally okay. And then the next thing is augmentation pressure. This is the extra pressure on your systolic peak from waves reflecting back off of stiff arteries. And why it matters is each 10 millimeter increase raises cardiovascular event risk by about 30%, marking hypertension and plaque buildup. Next thing is augmentation index, is the augmentation pressure as a percent of total pulse pressure, quantifying the contribution of wave reflections to overall pressure. Why it matters. It's a direct measure of artery stiffness and vascular aging. A 10% rise results in 35 to 40% higher risk of heart disease or death, even after accounting for standard risks. And then I think it is the last thing now is the subendocardial viability ratio. This is the ratio showing how well your heart muscle gets oxygen supply during relaxation versus demand during contraction. And why this matters is higher SEVR means better heart nourishment. Lower values flag silent strain or poor coronary reserve, especially with high blood pressure or stiff vessels. It's a key clue to cardiac efficiency before symptoms appear. If it all seems a little bit overwhelming, not a problem. We can sort out the interpretation and plan around addressing any abnormalities, but you are able to now collect this data at home where previously this was not possible.
Why do these measurements matter for longevity and heart health?
So these parameters often show problems like arterial stiffness, long before regular blood pressure climbs or you feel anything. Stiffer arteries widen pulse pressure, increase heart workload, and reduce blood flow to the heart during relaxation. Spotting this early lets us detect hidden issues, assess true risk more accurately, and personalize treatment to protect your arteries and extend healthy years.
How do we actually use this information in practice?
So in my longevity-focused care, these insights help us catch subclinical vascular and heart changes sooner, fine-tune risk assessment with real physiologic data, and choose the best therapies like certain blood pressure medications, statins, SGLT2 inhibitors, exercise programs, or even tweaks to one's diet that specifically improve central blood pressure, arterial stiffness, and heart perfusion, including SEVR. And we can track progress over time through the app and look at the trends and reports that the device is able to generate, seeing clear improvements that lower your long-term risk. The evidence shows these interventions really work to make your arteries healthier and support a longer, stronger life.
How easy is the device to use and who should consider it?
It's pretty much as easy as a regular blood pressure cuff. Put it on the same way, you take a quick measurement. It does blow up and deflate a couple of times during the measurement, and then you can get the results on your app. It's built for regular home use and trusted by cardiologists. Note, however, that each person needs to get their own device for accurate, personalized reports. If you're serious about longevity and want to optimize your vascular health, this is a game changer. If you're interested, head to and use the coupon code Dr. Fraser, just DRFRASER, all uppercase, no space between it, for 20% off. Thanks for watching.